The NBMEs, they ask you topics which are really easy, but the way they ask question is what makes it difficult and somewhat even deceptive. Today I'm going to cover such an easy topic of specific learning disorder, SLD, and I'm going to teach you it in such a way that you do not confuse it if it turns out in your final NBME exam. Now, when it comes to SLD, the scenario which they like to ask is a parent brings their child to your clinic, and the main complaint of the parent is academic difficulty. Like the child may be failing in exam, the child may be having trouble reading in the exam, and then they ask you the diagnosis, and they can throw around all types of options to confuse you. For example, one of the options might be your good old ADHD. Now, kid having problem difficulty in school sounds like a ADHD. Other option might be autism. The other option could just be, intellectual disability. Hmm? This can be one of those options. Could be what's going to be today's topic, SLD. Okay. Now, this is specific learning disorder. Welcome to Pursuit of Medicine. This is Azim Memdani, and today I'll be teaching you how to correctly identify SLD and not to get confused with autism, ADHD, and other disorders in the options. Coming to the core idea behind this, the vignette, it's going to tell you somewhere or other that the child has normal. I like to write normal like this: normal intelligence. Somewhere the vignette is going to give you this clue that he has normal intelligence, normal attention, but he has some specific learning problem, and this problem is causing distress, and this is a problem which is persistent. This is the idea which you should be knowing, that the IQ is normal, attention is normal. There is some problem in the specific learning. Now let me give you an analogy to understand specific learning disorder. Now in the computer we have something called as the CPU, central processing unit. Now the CPU gives connection to, let's say, the keyboard, the mouse, and let's say n number of things. Now if there's a problem with the CPU, all of the functions would be affected. But if there's a problem in one of the wirings from the CPU to the mouse, okay, so if from the CPU is all right, CPU is in good condition, but if there's a problem in the wire going from the CPU to one particular application like the keyboard or mouse or whatever, if the wire is faulty, huh, then there will not be transmission in this particular application, but all the other particular applications of the computer will be working. Now the same thing happens in specific learning disorder. The intelligence is good, but there is one specific area of the cognitive function. It could be learning, it could be calculating, it could be language. One specific area is affected, and depending on that we have different types of specific learning disorders. Like the problem, if the problem is learning, like learning new words, etc., the problem is called as dyslexia, where the person basically has a learning problem to new words. Learning problem to new words. Now this person might have difficulty in recognizing words, in mispronouncing word. He avoids reading, this type of a person. Now this could be something like dysgraphia. This is a G. this is a type of SLD where the child can learn. He has no problem with learning you new stuff, but when it comes to writing, there is problem. So this child may not be good with writing essays. Now there is something called as dyscalculia, where the child may not particularly be good with math. The vignette might say you that he is good with English, he's good at dance, he's good at other recreational activity, he's good at science, biology, but he has calculation problems. Then you should be going towards dyscalculia. I myself think that I might be suffering from the last one. Now let's just come to solving some questions on how they might test you. Remember that they will test you in a way which is far more difficult than the questions which I am using. The questions which you are going to see in your real exam, they will be far more difficult than this. But so that you learn, I have made some basic dummy questions. Now we have got a 9-year-old boy who has poor school performance. He pays attention. Now this is really important, that he pays attention, okay, and he follows instructions. This is really important, but he struggles with reading aloud, reads slowly, mispronounces, avoids reading tasks. Mathematical skills are age appropriate. What is the diagnosis? Now see, look at how he has said that he pays attention. If the question is saying that he pays attention, you should not be selecting ADHD. If he follows instructions and his social interaction is normal, then it's not autism. Okay, he's good at maths, that shows that it's not intellectual disability, and he is good with oral comprehension. Oral comprehension is good, that means it's not expressive language disorder. Now we are left with specific learning disorder with impairment in reading. So that's how they confuse you. Remember, ADHD child is always going to have attention problems in two settings: home, school. All right. Whereas SLD, no attention problems, no problems with social connections. Let's go to another case. We have got a 7-year-old girl who is having difficulty reading, spelling. She is attentive in class, follows instructions, complete assignment, no behavioral problems. Mathematic performance is appropriate for the age. Which of the findings most strongly supports specific learning disorder over ADHD? It's normal classroom attention and behavior, if you are getting me this right. So the USMLE, basically they need to know that whether you can know the difference between ADHD and SLD. Like I've already told you, ADHD has got inattention and impulsivity across multiple settings. This is what the vignette will clearly tell you. And if the answer is going to be intellectual disability, they will say you that there is a global delay in all the domains, not specifically academics. The answer is ODD, oppositional defiant disorder. They're gonna have problems like angry behavior, etc. So remember this, everything is normal, just the problem is in the academics. Then you have to pick the option as SLD in the exams. Now why the USMLE or the NBME they test this topic? Why it is important for a doctor to learn this? Because see, the children with SLD, if you don't detect it, you don't do special measures, special teachings, then these people are prone to depression and are prone to other mental illness, and they are prone to school dropouts. So this is what we do not want. We do not want a child who has SLD to slip down into depression and to slip down into school dropout and even go a step beyond further. We do not want that. So we want the doctor to be able to at least recognize SLD. Coming to the management, there is no pharmacology unlike in ADHD. Okay, so there is only targeted academic interventions. What we can do is we can do individualized educational plans for these people, and we can do academic accommodations for these people. Medications are only used for ADHD, not for SLD. Remember that. The final takeaway is that you need to know the difference between ADHD and SLD when it comes to NBME exams. Now I hope you will not confuse between ADHD versus SLD versus autism if they show up on your NBMEs.